And the role of the dental professional here, understand the condition, take a complete medication history, document carefully. So now, if you have a hip fracture, at 50 probably wasn't the solution. But nonetheless, having 26 miles, okay, like who needs this psychiatrist, right? When I married him, I'm sure it's the boys that turned them gray, not me. This is the older ENT son who, you know, I started this morning saying, we are, and this is really interesting and not hard to do. So one of the tracks we all lay for approximately 40% reduction in the risk of hip fractures for teenagers. You know, and you know how it's the sequelae of degenerative joint disease. You can have total joints or you can have pins. It's the total joint we're going to worry about. And there is a debate for more than in 2012, they came up with guidelines that said it's no longer the standard of care to routinely give antibiotic prophylaxis to patients who have a history of joint replacement. It was a report from the ADA Council on Scientific Affairs whether the patient had complications or not. So I think these guidelines are really going to require us to have a conversation with the patients. Make sure I have a good history, that they're not allergic to the antibiotic, because that's the trouble we get into. The danger with the orthopedic surgeon says, yes, the antibiotics are necessary. Patients that we had for a number of years, they're allergic to penicillin, that's clindamycin, 60 minutes before the patient, as well as affecting the productive tissue, meaning diseases or conditions. Similarly, systemic health problems can affect oral health in the patient with Sjogren's disease. If your patient presents with patients are learning with us, and our patients are watching us learn. You know, how many patients come in these days proof to it, but you know yourself, so you can take care of everyone else. And finally, just some
The resources for women's health: www.healthywomen.org, womancando.org, www.nih.gov. The resources for women's health as this aspect of the Dental Association of Women comes to a close. We have a slide for resources for women's health. One is www.healthywomen.org. The second is www.womancando.org and www.nih.gov. A session of new dentist in progress. I'm Dr. Thompson, the editor of Health and Development magazine, and with me is who?
Hello, how are you?
Great. I'm talking with Frank W., an officer who is a dentist. What has been your experience with the new dentist program?
I think the program was laid out pretty well, and I like how collaborative it is as far as being able to hone in on the new dentist and being able to have the resources and be able to kind of bounce ideas off of each other. And I like how it's in conjunction with ADA, and a lot of the information I think I'll be able to definitely use in my day-to-day practice and be able to further hone my clinical skills, and also the collaboration with other dentists, which is what I enjoy a lot.
So, what would you say to dentists who are out there and they are new graduates and have not been here before? Why should they come?
I'd say that definitely you can definitely increase your clinical skill set, and as well as being collaborative. It's always better to be with unification of dentists versus doing it by yourself, and you can share a lot of experiences together and bounce ideas off of each other. So I think that's a very great resource, and you should definitely come out.
Thank you very much, sir.